to the Plant-Based Wellness Podcast. My name is Jami Dulaney, and I'm your host. I'm a plant-based cardiologist and endurance athlete living in Southwest Florida. Welcome and thanks for listening. Well, as you can see, we've gone live, not really live, but we're going video now as well as audio. So I hope you like this format. You'll always be able to download just the audio version. We're also going to offer this via Spotify on our website, so you can go directly to drdulaney.com and listen to this as well or watch it. So I hope this provides a little bit better content, maybe more content, or at least something to look at while you listen, perhaps. I have run into several of my listeners in ultra marathons. We've met them along the road, various locations and veg fests. It's always nice to put a face with a name, I guess. I joke that, I'm the white-haired doctor now. It's funny, when I first started, I have a couple patients that I've had my practice since I came to Florida. And back in the day, in my 30s, I did heart caths and pacemakers on these individuals. And one of them said, I wasn't sure whether or not I trust you. You look so young. And when I think back, it's like, geez, I don't know that I trust me either at being so young. So there's a difference over time. But having been a cardiologist for 30 years, it's given me a little bit of perspective on what works, what doesn't work, and what I've done and how it's affected people as they've aged and gone on through their lives. So it's been an interesting progression. So this podcast is also progressing from a video of 518 episodes. I'm sorry, an audio of 518 episodes, and now we have a video as well. So I hope you'll stick with me for some of these video episodes. One of the things that I ran into this week was a question on whether I went to Dr. Chat GPT or did AI for my medical information. And I kind of giggled. I told the person, actually, again, been a doctor for a long time. I went to medical school, I read the journals, and they said, yes, but all of the journals are uploaded onto AI, and so you get all of the information, and it's much more accurate. But the problem with that is that all of the information is uploaded. So it matters what information is uploaded. And over the past couple of weeks, some of the editors of New England Journal of Medicine and Lancet have come forth and admitted that there's a lot of pharmaceutical bias in some of the journal articles. And a lot of journal articles have been retracted over time. And it depends on how you search things to get information. So yes, I think it's really good for patients and people that have healthcare issues to do their own research and become educated so that they can ask their physician questions. And I think physicians should be ready for those answers and be able to be ready for those questions and be able to give answers to those questions or to the best of their ability from what they've seen over the time and the course that they've been practicing. But not one study or group of studies is applicable to one individual. So, depending on somebody's age, somebody's size, somebody's other comorbidities, other illnesses that they have had, other medications that they've had, we still need unique treatment for our individual ailments, so to speak, and individual therapies, just like an individual plan for whatever you're going to do. You just don't want the cookbook plan for whatever, so to speak. The other thing that happened this week that was funny is I got called sturdy. I'll invite you to keep following Rip Esselstyn's Plant Strong podcast. I'll be on there in the next couple of months. But he interviewed me and we were talking about ultra runner, and he said, you don't look like one of those emaciated runners. You look sturdy. And we talked about being a healthy, plant strong individual as opposed to perhaps a junk food vegan. But in my mind, sturdy, as far as a woman goes, means a little bit different. And it kind of made me chuckle when he said that. He meant it in a different light of sorts, but nevertheless, how we give adjectives to people does make a difference. The other thing that I got called this week was a study was published this month looking at biomarkers to different organ aging. And for instance, there are now ways to measure in our blood different methylation type of changes that are associated with the DNA of our kidney, of our heart, of various organs, and we can see if our organs are aging more quickly than we are. There's some apps that look at your overall fitness. Garmin has one that looks and says, you're 62 years old, but you have the fitness level of a 50-year-old, and makes people feel good if they have the fitness level of a 50-year-old. But what if you were to have a blood test that says your organs are 75, but you're 60? What would you do? What would you do if you were 40 years of age and your kidneys were that of a 60-year-old person? What kind of changes would you make? How would those changes affect the other organs? There are things that we really don't know. We get a lot of information sometimes, but what we do with that information can even become more confusing than we thought, because we all get tests to hopefully reassure us that everything is good. But when the tests come back not so good, it's a little bit more difficult to interpret. The other things that happen are people are able to go on and order a battery of tests through various companies. They could be just bundles of tests, or you could go in and you can go into laboratories and pick your own bundles. Different coaching services have their different bundles. But what they turn out to be is a giant set of labs that may or may not be necessary to draw at different times. Things like cortisol vary according to the time of day, the stress levels, the environment that they're drawn in. So do hormones. And there are a whole host of other tests that, while may be a marker of an inflammatory condition or suggest inflammation, sometimes there's positive ones and negative ones. Which one do you believe in a battery of tests? If some say you have inflamed vessels and others say you don't, which are more accurate? There's not a whole lot of diagnostic credibility with some of these tests. So people end up with a battery of tests that they really don't know what to do with, and it can become very worrisome. And sometimes the tests, while they're only blood tests, then lead to more diagnostic procedures, invasive procedures, maybe that contain radiation, such as CT angios and so forth, that lead people down a road that they may have disease and make them now into a chronic patient where we're going to have to follow these tests on a year-by-year basis, hoping that they get better or they don't get worse. And what do we do with it anyway? What the reality of it is, most of the basic blood panel markers that we look at can really give a good clue to how people are doing, associated with a good history and physical. And that's really what's missing, is people actually taking time to sit down with people and talk about how they actually feel with regards to day-to-day life, how they feel with exercise, are they exercising, and then correlate that with their blood work. Are they hydrated when they have blood work? Are they chronically mildly dehydrated? Are they pre-diabetic, which leads to a dehydration, which might cause a kidney abnormality? So there are a lot of things that kind of influence some of these larger tests, and it's better to actually see someone first in person. I guess Zoom would be a second tier, but we like to see people if we possibly can, and talk to them, and then order tests based on what we've seen and listened and come up with from a history and physical. Then we order the diagnostic blood test to, again, then lead us and narrow us down a track even further to become more specific what is potentially a problem, as opposed to just ordering hundreds of tests hoping something sticks on the wall. And again, sometimes with those hundreds of tests, you uncover things that may not change the course of the disease that it suggests that you might even have. Again, finding cancer cells early when you don't have a tumor, what does one do? So we really don't know what to do with some of these tests. And again, while they may be interesting and may be puzzles for people to look at, the reality of it is it's usually a lot of money that generates more worry than not. And we can go a long way by saying, let's make you healthy based on your history and physical by changing perhaps your nutrition and exercise program. Because as I'm going to show you in another test that was just done, those two things do more to change the course of one's prognosis than most other interventions. When we're looking at some of these tests, we're looking, when you throw a bunch of tests out all at once, we're looking to catch something. So it's a wide net. And in the medical terms, we call that sensitivity. How can we pick up, what test can we do that picks up a disease in everyone? So it's a very broad net that we catch a lot of people, but often with those very broad nets, it's not very specific and it might not be true at all. So we get a lot of people that have an abnormal test that don't really have the disease. And then there's the other spectrum of the testing process where it can be very specific. So if someone actually has that abnormality on a test or has that abnormality in the blood work, it's pretty certain that they have that particular disease, but we miss a lot of other people. So we catch very few and it's pretty accurate, but we miss a whole lot, or we catch a lot and we have a lot of inaccuracies. We like to catch as many as possible and be as accurate as possible, but that rarely happens with a diagnostic test, and especially broad blood tests. So that's why we go back to that history and physical from the get-go. And then it comes down to what are you going to do with it? What are you going to do with the answers? A lot of times, again, it leads to more tests, and it can even lead to tests that could hurt you. The question, will you change your course? Will you change your nutrition? Will you change your exercise habits? Is that enough to actually motivate you? And most of the time, it really isn't. People may get afraid for a short bit of time, but again, if you don't feel bad, like people with blood pressure, they don't feel bad with their blood pressure, so they rarely do anything about it until they start to feel bad. And then that's when people want to backpedal a little bit. I heard people speak of, I eat clean a lot this week. I'm not sure ever what that means. Clean means to me, perhaps the vegetables have been washed. They're not right out of the ground. But clean to a lot of people means not processed, which I would agree with. It's not processed. But then it becomes, is chicken clean? I'll tell you, any meat is not clean. It's very contaminated with bacteria. It's been salted maybe in a brine, but it's anything but clean. So animal products aren't clean no matter where they came from. The processing in of themselves is a dirty process, and it's very likely to lead to some bacterial contamination. That's why most foodborne illnesses arise from animal products. So clean energy to me would be something that there's not a lot of byproducts. So I could make a little comparison between eggs and oatmeal and fruit, two standard breakfasts perhaps. So the egg, the incredible egg, as the egg industry would put it, contains a lot of minerals and vitamins. It contains protein, contains calories that can be turned into energy by your body. But it also contains saturated fat that your body can use to make cholesterol. It also contains cholesterol that your body can then store as cholesterol. And it contains other contaminants, perhaps bacterial contaminants, but it contains anything that that chicken may have passed along and what that chicken ate. So depending on what that chicken was exposed to, has a lot to do with that egg. So even if you had a chicken and an egg from the backyard, it's still not entirely clean because you have these other things that your body doesn't necessarily need. You don't need saturated fat, you don't need cholesterol. So you have to store those things or deal with them. On the other hand, if you had oatmeal, We'll say it's an organic oatmeal. Your body can use the carbohydrates to turn into ultimately sugar. Don't panic, but that glucose will be turned into energy. The fiber can be used to feed your good gut microbiome. It can also be used to increase transit through the gut. But the fiber in and of itself is good for you, decreases the absorption of other toxins. Fruit, very simple to absorb into fructose and glucose that can be turned readily and quickly into energy by your body. So we absorb the food through our intestines. It goes into our bloodstream. It goes into our muscles, and we can use those without much in the way of, if any, byproducts, the only byproducts being water and carbon dioxide. So fruit would be a very clean fuel. Vegetables would be a very clean fuel. When we have to process grains, they become a little bit less, perhaps, but compared to animal products, plant food, fruit, very clean in my estimation of what actually is clean. When you look at people eating sandwiches with lunch meat, and you have all those byproducts versus beans, rice, and greens. The beans, rice, and greens would be a much cleaner type food. So the main study that I wanted to look at today was a study just out in the New England Journal of Medicine, and it was presented in recent oncology large meeting. And it looked at colon cancer survivors and exercise. We don't often think about colon cancer and exercise as being linked, but we know in general that all cancers are less in people that are fit and exercise. But what happens after you have a diagnosis of a disease? And so this study was a phase 3 trial. 55 different university centers were involved. They looked at patients with stage 3 colon cancer that had had surgery and then adjuvant chemotherapy, so surgery followed by chemotherapy. And they followed them for several years, up to 7.9 years of a mean average follow-up time. This study went on from 2009 to 2024. And they divided people into an exercise group or an education group. And the education group were given online and pamphlets and traditional education on eating healthy and exercise. And the exercise group were given intense exercise regimens. They had face-to-face exercise for a prolonged period of time. They had to complete 24 sessions out of a 30-day period. So they were really on these people to stay the course. There were 889 people in the exercise group and 440 people in the just the education group. 5 years later, the disease-free survival, so no evidence of recurrent colon cancer, was 80.3% in the exercise group and 73.9% in the health education group. After 8 years, there was a 90.3% survival in the exercise group and an 83.2% survival in the health education group only. In the exercise group, they looked at behavioral modification as well as exercise, and they looked to have them increase their exercise for the first 6 months and then have a goal of 10 metabolic equivalents, or 10 METs is what you've heard me use before, per week. That would amount to 3 to 4 very vigorous 40-minute to an hour sessions of walking, or 30 minutes of jogging with getting the heart rate up. And again, these sessions would be at least 10 METs. The goal was to increase over 6 months, then to maintain that, and then to actually increase if possible. So this was a very dedicated group of individuals that became really consistent exercisers, very dedicated. So you might say they were training to keep their colon cancer away, and they were ultimately very, very successful. The relative risk of reduction, and we don't like to talk about relative risk, was 37%. But again, if you look, 90 83.3 versus 83.2, a significant benefit by vigorous exercise in stage 3 colon cancer. So this is a tumor that's outside of into the lymphatic system. There was a 7.1% difference at 10 years. There was a decrease in metastatic disease, but there was also a decrease between the two groups in the development of different cancers, such as liver or prostate or even a new colon cancer. So not only did these people see a survival benefit from their own their initial cancer, but they had a decreased incidence of cancers that come back. Because again, chemotherapy has a risk, and we know now also that some of the procedures that we use to monitor colon cancer, the repeated CT scans that people are exposed to over the years, but even for various other things, can increase the risk of cancer. So exercise actually helps to mitigate some of these new cancers as well as recurrence. This has been thought of in the review of these papers. This is such a large improvement. It's really up there with any of the better chemotherapy or any other medicine type of treatment. And this was just behavioral and exercise. It didn't even take into account whether people perhaps became plant-based or changed their diet. And it was in people that were also above a normal BMI as well as below a normal BMI. So, oftentimes when people get a diagnosis of cancer, they think that they're a victim and there's nothing that they can do, and they wait for the oncology team to give a protocol, and they follow the protocol that their doctor gives, but their doctor doesn't give them any homework to do. And, certainly when people have gone through chemotherapy, they become weakened, they lose muscle mass, which again, people lose mitochondria when they lose muscle mass, and these mitochondria are responsible for processing nutrients. They're responsible for helping our immune system to repair itself. So with loss of muscle mass, your body becomes weakened. So the chemotherapy often weakens people to the event that they can't fight off these other illnesses. Some of the therapies, would also potentially increase the risk for cardiovascular toxicities, cardiomyopathies, and we know that exercise is good for this. So this is of great hope for people that have cancer, but it should be of great hope for people to want another reason to exercise to prevent the development of disease, because just doing this daily exercise and being, not calling it in, not phoning it in, not getting the 5,000 steps, walking around using your arm, but actually going for a vigorous walk 3 to 4 times a week for a significant period of time can do so much to decrease your risk, not only from cardiovascular illness, but from cancers. We've seen it with breast cancer, but now this is really a landmark study with colon cancer. So like I said, if people would also adopt a plant-based diet that improves their immune system as well, foods that decrease the blood vessel growth into cancers. So a plant-based diet does all of these things to help as well. You probably could see even a better response. So there's tremendous hope when we look at just diet and exercise for interventions for cancer. Cancer seems like such a death sentence, and people become victims. And again, people are so debilitated by the some of the treatments that they just can't see the forest for the trees. And this study to me was very encouraging for people with any cancer should be going out and exercising. Of course, again, there's nobody that's listening to this podcast that shouldn't be going out and doing their exercise. I think that, when it's very difficult to look and decide sometimes on therapies and interventions that are offered, and you try to apply the statistics of many to one, and it's very, very difficult in choosing. But I think, when you feel like you can do something with your nutrition and your exercise that's actually making a difference, then you can take those statistics of many and say, listen, if those people did good with this, then I'm going to do so much better because I have diet and exercise on my side. So keep that in mind. Another reason to do your exercise and eat plant-based, for sure. So what am I up to? I am getting ready to do a night run, a 21-mile night run to, again, train the trails at nighttime, train the lights and nutrition in the nighttime, and evening run. I'm going to do that next Saturday here in Florida. Typically, when you start a long run, you start it in the morning, so you have breakfast, and then you go start your run, and then you're doing the nutrition of whatever it is you do when you run, so taking in gels or some easy digestible solid food. But this will be an experience of running. I'll start, I think, at 5:30 in the evening. Here in Florida, it'll still be in the 90s. But I'll be running 3 loops of 7 miles, and it'll give me an idea on how my body's going to react in the heat of the day after I've eaten regular food all day, and then going and out and exercising. How to maintain hydration into the evening, because as the day goes for anybody, if you're not drinking enough water, you want to stay hydrated, but living through the day and driving there through the, and getting there hydrated, and then keeping that going through the evening will be an interesting turn of events. Navigating in the night, using, we have headlamps and some light sources. One of the ones we use is called a Kagala. It looks kind of, it's actually very, very bright LED lumens, so it lights up the trail pretty good, but you carry a battery pack, so troubleshooting those things to make sure they work. And so that'll be a good training run. And then in June, we'll go to Colorado to practice on the trails of Colorado, which will actually be on the trail in Leadville, the Leadville 100 trail. So we'll do parts of that 100-mile course in June, practicing technical, again, practicing hydration, practicing with the pack. And then out in July to do the 50-mile run at Silver Rush, same place in Leadville, but a different course. And then the Leadville 100 is the ultimate goal in August. So still working on that training, strength training to get ready to run up hills and down hills and to be more resilient, training with the pack on, carrying the vest full of water. Heat training here in Florida. I did a 20-mile run last Friday morning. That felt like I was running inside my dryer, very humid, hot with the pack. So practice carrying, again, 1.8 liters of fluid and plus some electrolytes, and practice in taking, what I would do on a hot day, which I'm hoping will correlate to how it'll be at altitude. So the progress continues, trying to lay the plan, work the mindset, and, add in things that give me confidence for the troubleshooting that I'll have to do with the longer races. And that's really what training is about. It is to put your body under stress to a similar situation that you may face in a race condition, so that you can get used to troubleshooting, dealing with adversity, and experiencing what it'll be like to have some discomfort during the race. It's not going to be without discomfort, so there's no reason to have a mindset that it's not going to be hard. It will be hard, but it's about breaking things down into steps and practicing those processes. So you can apply that to nutrition. I talked to a lady today that, we talked that, 30 days of doing a new nutrition plan and some new exercise might be hard just starting out, but it's not as bad as if you take it one day at a time and you plan one day at a time, maybe a couple days in a row as far as meal planning. So we laid out a game plan for her to plan her meals and do a little exercise that she could fit in her day, because a lot of it is how do you fit something new into your already busy day. When it comes to being plant-based, how do you make these meals if it's complicated and you're on a busy work schedule or you have kids or people are finicky. So it's all about learning how to get food on the table in 30 minutes or less during the week, how to make it not stressful because you don't need much more stress in your life, I'm sure. And so that's one of the things we do in our practice. So we help people troubleshoot and game plan on how to get healthier and how to implement some of these exercise changes that we talked about, and how to make decisions on what they want to do with their treatment, and to help give them some confidence on the decisions that they've made. Because ultimately it's a physician's job to understand a patient, both their physiology, but also where they come from an emotional and mental standpoint, and help them to make the best decision that they can for them, and then to support them in whatever that decision is and go forward. And so we like to do that in our practice. And if you want to hear some more about it, you can go over to drdulaney.com, DoctorDulaney, and learn more about what we have to offer. We have just website memberships, and we also have memberships where we talk to you once a month, and then we have full memberships where I'll Zoom with you. We have a lot of content on our website. We're going to be adding more with these videos, but we're also, we have nutrition classes and mobility classes. I'm dressed from the mobility class today, where I went through balance training, strength training, with what you could do with body weight. So we do a lot of that in our practice. Go onto the website and check it out. I appreciate it. If you have any questions, you can always email me at Jami, Jami, at drdulaney.com. This will be available on multiple formats. I hope you enjoy it. We may be delaying some episodes for a little bit till we get some of the kinks worked out, but I hope you enjoy this format, and love to hear from you. And thanks for listening as always.